Ministry of Health is conducting vaccination outreaches in communities targeting measles as a result of an ongoing outbreak in 102 districts so far. Measles is one of the most contagious human diseases where one person can infect a dozen others, especially when they are not fully vaccinated. Dr. Michael Baganizi, the program manager of the Uganda National Expanded Program on Immunization, UNEPI, says the country has had persistent outbreaks since 2 years ago.
You know, there are two doses for measles rubella. The first one is at 9 months and the second one is at 18 months, so 1.5 years. So you can find that they missed their vaccination and now they get, most of them usually have missed their vaccination, and maybe about 60% of them. Then the other about 20% of them missed their second, because the second vaccination is supposed to boost the first one.
According to the ministry, there are close to 200 registered cases that are being handled at various health facilities across the country.
About 42 districts have reported at least 3 cases of measles in this year we are in 2025, but about 64 districts have had at least 1 case of reported a measles case.
Vaccination, according to Dr. Baganizi, is routine, but the persistent outbreak has pushed for extra efforts towards catching up with those that could have skipped or missed the jabs. In 2023, 2.2 million children across the world missed the first life-saving measles vaccine dose.
There are some reasons that cause them to miss out. It could be access. A sub-county or an entity, a community is far away from a facility, health facilities. Maybe there are no outreaches that are reaching them. Or it could be there are some areas where I've gone and you find maybe there's a predominant religious group that is teaching against vaccination in that maybe sub-county or even bigger than a sub-county, and that is causing mothers not to go for vaccination.
The infection can be fatal, especially for children under 5 years of age, but anyone, including adults, can succumb to it. Treatment targets symptoms including high-grade fevers, runny nose, and commonly small bumps all over the body and in the mouth. But Dr. Baganizi says it is important that you seek professional care from a health worker for better handling because of the serious health complications it could lead to, including pneumonia, brain inflammation, loss of sight or hearing, and death. Uganda is not alone. Other countries across the world have active outbreaks. Ethiopia and Nigeria top the list in Africa with 5,309 and 1,892 cases respectively. Yemen, India, and Pakistan top the global list with 10,794, 7,201, and 6,217 cases respectively. In 2023, 107,500 lives were lost due to measles, a disease preventable by vaccination. Walter Mwesigye, NTV.